All right, so welcome to everyone who is here today. Thanks so much for being here. I know that everyone's sort of in a weird area of uncertainty, and we're hoping to bring a little bit more to light about emergency management and preparedness today. I'm Carolyn, I'm with Curio 412, and these virtual roundtables have come to be as a way to learn, but also a way to share. So for the first 30 to 40 minutes of today's session, you'll be hearing from myself as well as from Emma Pyle, who's with Alliance for Response, and Herb Brichta, who is with AE Works. All of us have various stages of experience with emergency management, and I'll introduce them as we move through today. The last 20 minutes of this session, or 20 minutes or so, will be space to connect because we are all living in a virtual world, and it's harder to get outside of the people that we see on a regular basis to really share and exchange ideas. So we'll have a couple of small breakout sessions where you'll be able to talk to people who are sort of in your areas, and also to develop a network so you can share with each other what's working, what's not working, and share ways of dealing with different challenges. We're using Zoom today, so you've all been muted as you come in, but when we get to that breakout portion, please feel free to unmute so you can talk with the people who are in your room, share your video so we have a chance to see you. But as we work through the first portion, feel free to use the chat box at the side to ask any questions, and we will have time at the end of the first half of this session to ask any questions that you have to each of us. So with that, I am going to share my screen so that we can get the presentation portion of this session started. So like I said, today we're talking about emergency management planning and preparedness. This session is going to help you discuss strategies, tools, and tips for emergency management and preparedness at your organization, whether that is a small nonprofit or a small business. The partners that we have for this entire 6-session series, because we do have 6 sessions that go through these virtual roundtables throughout this week, the next week, and then the third and final week, are the Pittsburgh North Regional Chamber, Alliance for Response, Your Hangout Spot, AE Works, and the Heinz History Center Affiliates Program. Today, you'll be hearing from, like I said, Emma Pyle, Herb Brichta, and myself. Emma Pyle and I both serve on the Alliance for Response Steering Committee. Emma is also a member of the Cultural Resilience Network. She's a trained conservation technician, and works in the Preservation Lab at Carnegie Library of Pittsburgh. Her strengths include cleaning paper-based materials, creating custom enclosures, book repairs and structures, and she's also a member of the Guild of Bookworkers. Through Alliance for Response, Emma and I have worked to bring emergency management tips for preparedness with that steering committee. And Emma will talk more about the work that Alliance for Response does. Herb Brichta is here with us today also. He's from AE Works. He has experience in the military, healthcare sector, and private industry and leadership roles with specific responsibilities for preparing organizations to face evolving emergency situations, like what we're all currently dealing with now. He was directly involved in creating security, anti-terrorism, continuity of operations, and pandemic influenza plans. He leads the security risk management practice at AE Works, and for current clients, he has inspected workplaces across the country for safety, security, continuity of operations, which have helped employers prepare for moments like this. And he'll be sharing strategies with you on how to support your business and emergency preparedness. With that, I'm going to turn it over to Emma to give us a bit of background about Alliance for Response.
Sure. Thank you, Carolyn, for inviting me, and thank you everyone for being here today. I wish we could all be in person, but I'm glad we're making do. So like Carolyn said, I'm here today with Alliance for Response. This is our mission statement, as you can see. And I'll just give you a very quick overview of who we are and some of the resources we have to offer. So we are again, based in Pittsburgh. Alliance for Response is a nationwide organization, and we are just another tool that you can use in your toolkit during an emergency situation. We were founded in 2008 in cooperation with the Carnegie Museums. We hold meetings and speakers to foster education around disaster preparedness and cultural heritage preservation. We're a voluntary network of librarians, conservators, archivists, consultants, and emergency management personnel. Some of our past events included tours of Iron Mountain and other facilities, wet book salvaging demonstrations, tabletop natural disaster scenarios, among others. One of the big things that we offer is the use of a shared disaster supply cache for any organization who is part of our network. And what is in there, it's things that you would use in a recovery stage of an emergency. So some of the supplies include gloves, eye goggles, dust masks, buckets or heavy garbage bags. So once you're finished cleaning and with the remediation of a disaster, you would just be asked to stock up whatever you used for the next person or organization who may need it. It's a great resource, not only for the reliable supply of materials you may or may not have on hand, but because it is off-site from your location, it would be safe from whatever may have happened within your own building. We're always accepting new members to join us at our meetings. You can sign up for them. I believe there's a slide at the end with our information, our website, and we also have a Facebook page. We were in the midst of planning a mold cleaning workshop, but because of the state we're all in right now, that has been put on hiatus. But if you're interested in that or any other, anything else, you can sign up for emails, and we will get back to you when we all get back to normal or whatever that means. So yeah, with that, I'll hand it back over.
Thanks, Emma. I also want to give Herb a chance to talk about AE Works and the work that they do in the area as well. So go ahead, Herb.
Hi, thank you. I'm Herb. I'm with AE Works. We're based out of Pittsburgh, but we also have offices in State College and in Washington, D.C. In addition to offering the traditional architecture and engineering services, we've added planning, project services like construction management and owner's rep, and where I come in, risk management. Those business lines, they come as an integrated service offering in all of our design projects, and they're also offered in a standalone form. Thank you for allowing us to join today.
Great. So with that, I'd like to get more into the content that we'll be discussing today. So our agenda includes best practices of emergency management, emergency planning and preparedness, and also emergency response resources. I'd start by saying a lot of the information we'll present today has a lot of information to it. So it's good resources to have, and we'll go through a lot. And we'll do our best to break it down so you don't feel overwhelmed with everything that you could do. We're in the middle of an emergency right now, and usually that is a good time to maybe not do your planning now, but to take notes about what's going on throughout the process so you realize what areas you could really improve if you have an emergency management plan, or what areas you really need to think about if you haven't had a plan before but would like to put one in place. There's all different kinds of emergencies that an organization can experience. FEMA has a large definition of emergencies, and they include things like natural disasters, biological hazards, chemical hazards, active threats. Most commonly at Alliance for Response, we've seen fires and floods to be some of the most destructive things, but you can also have things like hurricanes or earthquakes or large snow piles. We know of a building that had its roof caved in by a really bad snowstorm. So those are all things that you can think about. So throughout today's session, we'll talk in general about emergencies and what you can do about a large range of different emergencies, but we'll also touch more specifically on the current situation we have with COVID-19 and give you a few tips for how to deal with that as well. So I'd like to start by asking Emma to go over the first portion of today, which is looking at before, during, and after an emergency, and why it's important to have these types of plans.
Great. So like Carolyn said, it's important to have an emergency plan, of course, for a lot of reasons. We don't want to think about something bad happening, but unfortunately, we live in a world where it's not a matter of if it will happen, but when something will happen. When you're in the midst of a disaster, whether that is a burst pipe or a pandemic, it is important to keep as calm and orderly as you can. And that's hard to do when you don't feel like you know what the next steps should be. But with a plan and with preparation, a bit of that stress can be eased because you'll have something to fall back on. What are some of the things that you can do before an emergency? Well, some of you may have already done some of those things. Have working smoke detectors and extinguishers in your establishment. Know where your fuse box is and how to shut your water off if need be. Practicing good communication with your staff and your public, making sure that everyone knows proper evacuation routes from your building. Also having up-to-date information of your staff, their emergency contacts, and keeping them updated of any changes that you may have made within your organization. Posting safety policies, distributing those policies to emergency personnel and your staff. Communication is really a huge thing that we can all do and we can always improve upon, I think. And that includes making lots of copies of these plans and storing them in different locations and not just have your one plan in your office, in your locked desk drawer, because you may not always be able to get to it. Be sure to practice safety drills and evacuations on a regular basis to lessen confusion when the time comes to implement them. By sharing this plan with others and practicing, you will help ensure you and your staff feel confident in knowing what to do during an emergency to minimize harm. The more you know and the more you prepare, the better off you will be and the less damage will occur. So that's all important before. And then during, which is where we all find ourselves now, you want to feel prepared to act and try and take control of the situation, whatever that may mean. So the more preparations you made before, the more drills and practicing you get in, the more smoothly things will run. This is not to say that nothing will go wrong. Not everything is in our control, so not everything can be thought of beforehand. I'm sure there are a lot of things that we're all thinking that we wish we had right now in place that we didn't before. But this isn't a bad thing. All of these things will only help guide you in making a better plan for the future. So any missteps or things that you wish you had, just try to remember them or write it down, or use this as a place to think about how to improve. Again, communication is very important right now. Try and communicate clearly, directly, and as often as you can. Remember that the first priority is life and safety of you, your staff, and the public you serve. So take those actions to move people from harm, and then proceed to control and contain the situation at hand. Sometimes the action you need to take will look like evacuating and calling 911. Sometimes it's to shut off a water main. Remember, your priority is life first, then stopping or managing the emergency. And then the third priority is property once the other two are stabilized. So then after the plan, this is the time once all personnel are safe and accounted for and the emergency has subsided, this is the time to debrief and take stock of the situation you just went through. At this point, you can reach out to professionals like your insurance agents, conservators, or AFR or AE Works or any of the groups mentioned today. We're here for advice on how to best recover any damaged inventory. This is also when you can go over how well your emergency scenario went. It's best to sit down with your staff and do this as a group, as different people will have different outlooks and input. There may be things that could have been done better, whether it is a communication or messaging error, or safety measures that can be put into place. Try to remember to be flexible and take an honest look at how things went. If something you had in your plan didn't work out well, being unwilling to try a different approach will not help you in the next scenario. These emergency plans are meant to be fluid and ever-changing to fit our ever-changing needs for them. Remember that a lack of an emergency plan can lead to an even bigger disaster, severe losses, multiple casualties, or financial collapse of the organization. We're trying to have that not happen today. So yeah, that's just a very brief overview of why to have a plan.
Thanks, Emma. So with Alliance for Response, we work very closely with the Conservation Center for Art and Historic Artifacts. They were the group that established the Pennsylvania Cultural Resilience Network, which is a volunteer network very similar to Alliance Response. Usually it's cultural professionals, emergency management professionals, and with the Conservation Center, they developed an emergency management cycle, which goes through plan, react, and recover, which goes through all of the steps that Emma just walked us through, and it's a cyclical process. So even though you never know when a disaster will hit, and we hope they don't hit all that often, it's always a continual learning process. So throughout today, we'll take a look at some of those best practices, which include things like conducting a risk assessment. So your organization might have way different risks than, say, an organization that's located in Florida or Utah, or any other number of places. You may have special inventory or collections. You may have special things that you need to manage. So conducting that risk assessment will help to identify what risks you are most vulnerable for, and then help you to plan accordingly for those. In emergency management, we know that it's hard to prepare for every situation, but a risk management can help plan for those that are most relevant to you. Then developing that emergency management plan, and Herb will go through and talk about that in a little more detail in just a minute. Being prepared with supplies and equipment is also very important. So like Emma said, there is a disaster cache available through Alliance for Response that has a number of different materials, but there's no reason you couldn't also make those emergency supply kits yourself. The Conservation Center has a list of different supplies that would be great to put in a kit, and there will be links and resources after this webinar to help you figure out if that's something you'd like to do, is develop your own emergency supply kit. And like Emma said, reviewing and revising this plan, following guidelines of local officials, and just practicing and going through this and communicating that with all of the constituents and stakeholders for your organization. I don't think we can stress that enough. You'll probably hear all of us say something about communication and practicing today for emergencies. So when you put your emergency management plan together, typically it includes things like a list of contacts and keeping those contacts in accessible places, whether that is having copies at home, copies in your workplace, copies in multiple areas so that you can know who to access or where to access that contact information at all times. Also having the contacts for local response agencies like your police, your fire agencies, and knowing those procedures and policies. Another thing to have in that plan are guidelines for training, storage, and other places that you're going to need to address. So Herb will walk through what that would look like in your plan. You want it to be as clear as possible for anyone who would need to access it. And really, in an emergency, anyone may need to access it. Emergencies don't really happen in convenient times, so knowing that maybe it's not going to be your IT person who has to deal with certain electrical failures or power failures or technological things. Like I just said, having that greatest risk identified, and also having all of the different plans for evacuations, floor plans, any other types of visual aids that are going to help you really to work through that plan. So at this point, I'll turn it over to Herb, and he's going to walk you through those steps for developing that plan and what it might look like.
Hi, thank you, Carolyn. So we have in emergency management, just before I get into the meat of the slide, you know, yes, we're kind of past the point where you want to start making a plan, but if you haven't done so, it's not too late, and it's important to start figuring it out now, right? And if you had a plan, you probably noticed that it's had to change, and you know, if it hasn't had to change yet, it's important to take time and, you know, continue to reevaluate your plan in the event it has to change in the future. Remember, yes, we have a horrible crisis going on now, but we still live on a planet, and weather hasn't gone anywhere. There was just an earthquake in Idaho. Hurricane season's coming up. So there's the very real possibility of stacked disasters and stacked emergencies. So don't lose sight of that. But as was said before, emergency management, it's primarily focused at the community level, and it's concerned with preserving lives. But with that in mind, like what we're seeing now, organizations other than your traditional police, fire, and the non-government aid organizations, other things have a role. Just look at the supermarkets. Moving forward, I wouldn't be surprised if, you know, food chain and, you know, the supermarkets become a part of municipal emergency planning efforts. That digression aside, we'll get back to the slide here, which is to develop the emergency management plan, you have to identify your organization's roles and then the roles of the individuals in the organization that collectively get that organizational mission accomplished. Your role in an emergency and your organization's role in an emergency, it might be as simple as evacuating everyone, locking up, and cleaning up when it's over. Or it could, you know, move towards more complex things such as preserving records, preserving collections against, you know, humidity, fire, theft, you know, and all of those secondary effects, what have you. Of course, it culminates at the government level where we have, you know, large organizations charged with keeping people on a mass scale. But when you know what needs to be done, you have to actually make your emergency response team. You know, for the typical audience here, that's going to include a facilities person, probably an IT person, definitely representatives from each of your critical functional areas, someone to handle PR, and then an overall person in charge. These are the people that are going to know how to turn things on and off. They're going to know how to get you back up and running, and they're also going to know how to render that workplace safe, put it into a safe condition if you do have to evacuate. Because if you do evacuate and leave your facility, you don't want to leave hazards that can hurt first responders. So you do want to make sure that you've either rendered that workplace safe or otherwise notified those that, you know, may have to get in there while you're away. You should also consider having a backup member for each team member, because as Carolyn said before, disasters don't respect vacations and sickness and all of those other components outside of, you know, work. Only after that do you actually get down and put pen to paper and start writing the plan. And you do want to write that in plain language that absolutely anyone can understand. The way I was taught it, write it so that your grandparents can understand it. Anyone that works with you should be able to pick this thing up, and not knowing anything about your specific field should be able to execute the plan. Probably not as fast as the primary, but again, be able to do it. I'll give you an example of that in a second. After you've written the plan, you actually have to practice it. Even if you just meet for an hour and go through the sequence of actions, a tabletop exercise, that's valuable. But the more you review it, the more in depth you practice it, the more errors you're going to find, and the better the plan becomes. And then finally, as was said before, again, people need to be able to get to the plan. It's no good if it's on the boss's computer. It's no good if it's on the emergency management person's computer and nobody can get to it. Printed copies, physical copies of it, posted in conspicuous places, distributed however you want to do it, but you actually have to get that into people's hands. So next slide, please. So this is what I meant by having step-by-step instructions with photos. Just a brief background. Routinely, like a large facility, they'll have a requirement to cut the air intakes off from time to time. If there's a chemical spill, if there's some kind of contaminant that's been introduced into the heating and ventilation system. So knowing how to cut the air off is an important emergency response measure. So this is how I would write that in a plan. And by the way, this is just some floor plan I pulled off the internet, and the photos are actually my house's photos. So I'm not divulging anybody's client data here or anything like that. So in step one, though, we explain what this is and why we're doing it. So, in the event we have to shut the HVAC system off because of contamination, this is the steps you follow. Step two, we've identified, all right, the cutoff switch is located in the breaker panel in the kitchen. And then we have a picture with a big red arrow that shows where the panel is. Next slide, please. The next one, looks like my pictures didn't quite translate. They got rotated, but it's a picture of the breaker panel. So number three, it shows what the picture of the panel actually looks like. Some people might not know that. Of course, the facilities guy knows what a panel looks like, but Herb, who works in emergency management, might not know that. And then step four, we said, open the door, switch the breaker to the off position, and we've actually put circles on. Again, if this was rotated in the proper orientation, the circle would actually show which breaker to throw and what the off position actually looks like. And you could actually take this one step further and have a fifth picture in there that shows the breaker in the off position so the person can see what right looks like. But you want to have that level of detail throughout your plan so that way, again, anybody can understand it. So while the person who knows that function could immediately go and shut the HVAC system off in about half a second, another person could get it done in a reasonable amount of time by reading these instructions. Let's go to the next slide, please. So if emergency management is primarily concerned with lives, continuity of operations is really concerned with keeping your organization or your business running to the greatest extent possible during a disruption. And you've got a number of resources that were developed by FEMA. What it really boils down to is a functional decomposition of your organization, which really isn't dissimilar to what you might have done to make your emergency management plan. And this FEMA website, there's two hot links in the slide briefing there. You could go on FEMA.gov. There's a ton of information there, probably more than you'll know what to do with. Even those link templates, they're still a bit much for a smaller organization, but you can always delete the non-applicable parts. But just for those that might go on a website and find it akin to drinking from the proverbial fire hose, the next couple slides are the abridged Cliff Notes version of that FEMA guidance. So let's just go to the next slide. Okay, so the first thing you have to do is figure out what your organization needs to do to continue its mission. So if you're the fire department, that's pretty easy to figure out. If you're in a business, that function might be make widgets or provide widget services. If you're a food bank, it's collect, store, and distribute food. If you're a museum, it's preserve the collection. So, a very, very concrete, very specific definition of those essential functions is needed. The next thing you have to do is identify essential support functions. This starts to get political in some organizations because egos get involved, and some people don't like to be told that their job isn't necessarily essential. That essential doesn't mean unimportant. So an essential support function is something that's directly tied to the essential function. For the fire department, an essential support function is maintenance on their equipment. You can't fight fires if your truck doesn't start. For a manufacturing business, those support functions might be receiving raw materials and shipping finished materials. And then, there's others. My point is you have to do some introspective thought, and I'll pick on myself. The annual security training or the monthly safety class, those are still important. They'll still help you manage risks. still help you keep your people safe, keep your business running, but they're not essential. Your business can make widgets without the monthly safety briefing. Same thing if you go back to the fire department example, the annual volunteers dinner, not an essential function. It's very important. It's immensely important for, you know, getting community engagement and getting your volunteers, but the fire department can still fight fires without doing that dinner. So you do have to draw the line somewhere and identify those essential support functions. And then take a step further and identify the staff. And again, you know, nobody wants to be told it's not essential. I just spoke about, the same thing applies to your staff. And again, this is about layoffs. These essential people, you might have to invest in additional equipment so they can do what they need to do. You might have to pay them more, since the understanding is that they're available to be called into work during times of crisis when everybody else is staying safe at home. So, you know, it's not just a label, there's an expectation. I'll throw an example out. The township recreation director, not essential staff. Doesn't mean he's a bad guy. And, you know, I certainly recognize the outdoor fitness opportunities. But you don't need the sports guy when you're trying to get people back in their houses after a flood. So where this all boils down is the essential support systems. So they're the things that enable all of those functions that do things, right? So you have your fire truck and all the systems within that. In the manufacturing example, it's the equipment on the assembly line, the machines. If you're an IT organization, it's your server room, right? But then you continue to dig deeper. So that server room, right, that needs power and cooling. So electricity and air conditioning become essential systems. And then you have to dig a little deeper and you realize, all right, we need to invest in backup power. Then a backup generator becomes an essential system. And you continue to dig deeper and you realize that fuel storage is an essential component. And, you know, you can keep going on and on and on, but you do have to drill that far down. And while that you know, electricity one with the fuel and the generator, that might seem like a no-brainer now that we just talked about it, but we had Hurricane Katrina, and then a couple of years later, we had Hurricane Sandy hit New York. In Manhattan, hospitals had power issues. Well, they were smart enough to elevate the generators, but then they didn't do anything with the fuel. Guard troops literally carrying fuel up 10 flights of stairs to feed the generators because nobody thought about the fuel tanks. All right, so you still have to dig and dig and dig, and just because it seems intuitive now, you still have disconnects. I'm sure there were very smart people in New York City. I'm sure there was something done for those underground fuel tanks that everybody thought would work, but it didn't. And there was no other plan other than having dudes carrying fuel cans up and down steps. So again, all of that to get back to, we've done this whole big functional decomposition to go to identify all of those important things, because those are real investments. That's not a minor, you know, couple of dollars here and there. That's a very, very significant investment. So for a hospital, that makes sense, because that hospital has to serve that geographical area and it has to be up and operational. Now, if you were to take my company, for example, we don't need to have backup power in our office. We can work just fine somewhere else. So we're not going to spend millions of dollars on a backup generator and a fuel system, because it's not a smart investment. It's not essential. Let's go to the next slide. So once we've identified those essential functions, you figure out what can stay in place and what can't. So the functions that can stay in place, they're going to basically follow the emergency management plan and continue to build capability back to its normal level, you know, as soon as possible as the situation allows. Everything else, you have to move it to a temporary location. So you could rent office space outside of the impact area. You could have people work from home. In either case, you'll have to have some type of infrastructure in place. IT definitely comes to mind. You know, do you have servers? Are you cloud-based? That rented space is going to need to be able to support your data needs with probably an upgraded connection. If you have people working from home, are they taking organizational computers home and using them, or are they using personal devices? There's pros and cons to both. And then can your infrastructure even support telework? And then you have the people end of it, you know, timesheets, availability hours, all of that procedural stuff should be figured out in advance. It's much easier for your staff to go in and have a set of expectations already in place than to try to figure this out on the fly and add continual change into an already stressful situation. Because remember, the 8 hours of work every day is only a small part of your staff's equation in a disaster. Even now, they've got kids to worry about that are home. They have, family members that might be getting sick. So work is not all. You want to not add to the overall stress level if you don't have to. So once you've developed the infrastructure, you want to train and test your plan. We've talked to companies that literally have the IT guy coming in every day with all of this to monitor the server connections because the server can't support remote administration. So the whole office is on telework except for this guy who has to come in and operate the server. That's something that could have easily been figured out if they had everybody log in from home and try to work from home, give everybody half a day off and let them work at home just to test the system from time to time. Others have used online meeting tools like we're using, but the license they had couldn't support meetings with more than 5 people, which is, either an unplanned additional cost or, potentially very embarrassing if the first time you're doing that is with a client meeting. Again, all of these things were found out after the stay-at-home order, so a little bit of practicing could have made everybody better prepared. So I'll pass it back to Carolyn, who will talk more specifically about operating in this COVID-19 environment.
Thanks, Herb. So we are in the middle of an emergency right now, and we wanted to touch on a few things that may be more specific to your organizations and talk more about what you can do right now. So the first thing we wanted to touch on was cleaning and isolation strategies. We're thinking about this primarily in terms of places like libraries and collections, but it can also have a wider appeal to organizations that had inventories that are worried about how long COVID-19 can survive on different surfaces. And although it can behave similar to other coronaviruses, the research is still being done to figure out exactly how long it may last on different surfaces. But suffice it to say, it will vary under different conditions, whether that is heat or humidity, temperature, anything to do with the type of surface itself, whether it's wood or metal or plastic, paper. And so we have a couple of resources here. Obviously, always follow the World Health Organization and their guidance, but there is also some guidance on public health from COSTEP MA, which is for cultural organizations specifically, but it is a great resource with how long this might be able to survive. And it talks a lot about what you might want to do to think about limiting contamination, whether that is cleaning strategies for a lot of places that have inventories that may be a little bit easier, where you can get disinfectant routines and have regular ways of making sure things are clean. But if you're a library or a collection, that may be a bit more difficult because the same harsh chemicals that you would use to disinfect may be damaging to your collections or materials. And in those cases, it seems like isolation for an extended period of time, it seems like the best way to move forward with that. So please, like I said, keep up to date with World Health Organization and also check out that resource. Like I said, we'll have all of these resources up online by the end of the week. And there's some of them that are already there, so you can go and check those out for further information. And obviously, reach out to us as well. There's also some things you might want to know about OSHA regulations, and Herb's going to talk a little bit more about what those might mean for you and your place.
Sure, thank you. I'll keep it quick. So you're probably familiar with the OSHA General Duty Clause, which even if you're not subject to federal OSHA and you're subject to the state versions of it, nearly every state has the same type of General Duty Clause, which states that employers are required to provide a workplace that's free of recognized hazards. COVID-19 is obviously a recognized hazard at this point, and you do have to take steps to protect employees and not expose them unnecessarily. Probably the more interesting one, which continues to get people off guard, is that the N95 mask, the ones that are that hospitals are in need of, that everybody's buying up and wearing, OSHA actually classifies those as a negative pressure respirator. And that's not my interpretation. That's actually right there on the OSHA website if you look it up. So when you have, if you're going to, as an employer or as a person in charge, if you're going to mandate that somebody wear a respirator, you're required to have a respiratory program, which minimally includes the person has to be cleared by a doctor to wear a respirator, and then they have to be fit by somebody certified to fit people in a respirator. So again, that's mandatory use if you as an employer mandate it. Voluntary use is a totally different thing. Employees can wear masks if they choose to. I'm not saying you have to take them away. It's just if you're going to put an employee in a mask, realize that you do accept certain risk if you don't have a respiratory protection program in place. Back to you, Karen.
Thanks, Herb. So this slide just has general resources for readiness, emergency plans, continuity of operations. The one thing I didn't touch on when we were talking about emergency management plans was you may have one plan that has a very concise and comprehensive form of information like Herb had with all of the different photos and diagrams, but you might also want to consider doing a pocket response plan so that it's something all of your employees can have that just has the very basic information about either where to find your more comprehensive plan or having information like who to call in certain situations, whether that's the fire department or the police or your facilities manager. So having all of those items in one place, and we have a few resources that can help you think through that. And obviously any of us are happy to answer any questions you have afterwards and work through. We just have some general tips here. We've gone over most of them, and I'd like to give you all a chance to be able to talk in your breakout rooms now. So I'm gonna move forward on this slide, but definitely keep in mind all of the different things we've talked about, especially communicating, preparing, and practicing those plans. Before we get into our discussion section, we do have a few more upcoming sessions. Next week on Tuesday at 11, we have one on events planning and uncertainty. On Thursday, we also have how to support local organizations, and that's Tuesday at 11 and Thursday at 1 p.m. So with that, I'll give you our contact details. The slides will be available online, and I'll let us get into those breakout sessions, the virtual roundtable. Like I said, this is an opportunity for you to talk with people who are outside of your organization or the people that you've probably been interacting with to reach a few more people in that network to ask questions and work through challenges together. I'm going to stop our screen share here so that we can all talk candidly with each other. With the breakout rooms, once I start the breakout rooms and get them going,